All right, I believe we are live, and welcome to the Buzz Live, where we interview dental professional speakers on topics of industry, hot topics and industry trends. I'm your host, Vanessa Emerson, founder of Dental Speakers Bureau, and I'm excited tonight to be here with Dr. Tom Viola. Thanks for being here, Tom.
Vanessa, thank you. This is a great opportunity. I'm looking forward to it. This is great. Thank you so much.
I'm really looking forward to our conversation as well on a course that is a serious course, a serious topic. And while we're going to have fun talking tonight, I know this is something that's a really important course in dentistry. While we get started, and while I make sure that we are in fact live, if you're out there and tuned in, would you please type in the comments hello or hi Tom or whatever you'd like to say to let us know that you're out there and hearing us. And I'm going to check on my phone and make sure we're live. But could you start us out by giving us a little thumbnail about why you on this topic? You know, what is it about your history and your experience that brought you to this point to be able to speak on this topic?
You got it. Well, it's interesting. The opioid crisis, as it's called, really started to gain strength and gain speed in the Northeast. And unlike other trends in this country where things kind of start in the West and work their way east, this is the I could say one opportunity where I've seen it work the other way. An issue like this started in the Northeast, gained a lot of steam and caused a lot of deaths. And now legislation and the awareness at not only the state but also federal level really has spread from the Northeast south. And so when it came from Vermont and New Hampshire, where it seems to be the greatest problem, when it came to New Jersey, the State Board of Dentistry asked me, well, would you put a course together on opioids because we're thinking of making it mandated. And that's what I did. And I did a lot of research, but I also have a lot of personal history with opioids. I've had lots of patients over the years as a pharmacist. I've had lots of patients who've been dependent on opioids and who abused opioids. And even some members of my own family have had issues with opioids as well. So it pertains to me and it's close to me and near to me, both on a professional and a personal level. So I've done a lot as a pharmacologist and as a pharmacist to look at things and say, what can we do better as far as treating pain? And the heavy dependence we've had on opioids over the course of time comes from two sources. It comes from prescribers who want their patients to be comfortable, but also comes from patients who feel, I really need that because I'm going to be in a lot of pain. And what I try to do in both my online course and my live course is talk about using non-opioids to treat pain more successfully than opioids.
That's fabulous. Thank you for sharing that. It is a topic that I think has most people's lives have been touched in some way, but it's definitely something that's important for us to pay attention to in dentistry. And that's why we wanted to chat about your course, which is so cleverly titled Hurts So Good, and Management of Acute Dental Pain and Appropriate Opioid Prescribing Practices. Can you start us out, Tom, by helping us understand what would be, you've already kind of alluded to what's happening in the world, what's happening in the dental practice, what would attract the typical dental attendee to this course?
Well, and that's a liberal use of song titles and song lyrics in all my courses, to kind of get people aware of what the subject is. Hurts So Good came from the play on words. Most people say, gosh, this dental pain hurts so bad. And I think, with the way we approach pain in dentistry, we've relied so much on opioids to treat pain, but honestly, they really don't work to treat pain. They're good at masking it. They're good at delaying it. But as far as treating pain, we all know that dental pain is inflammation at the end of the day. So the ideal analgesic agent is a non-steroidal anti-inflammatory agent. So it can be hurts so good if we were to use the agents that we have available to us in an effective and an efficient manner in treating pain. And I like to think that we can eliminate or abolish dental pain typically within 48 hours. If we did that, we could change the public's perception of dentistry from one of, gosh, I'm going to go there and I'm going to be in pain, to, gosh, I'm going to go there and I'm going to make what's wrong with my mouth right and not worry so much about the pain. So shift it from a negative to a positive impact.
Oh, that's exciting. That's a real platform there, that could get some excitement behind that idea. So tell us more about that. Tell us more about what you cover in your course that would lead us toward that conclusion.
Yeah, most of my courses are all based on, the most up-to-date, latest science. And so this was no different. When I went out there and said, okay, what is it? What is the perfect or the dream cocktail, if you will, to treat dental pain? A lot of studies support the use of ibuprofen and Tylenol together in the moderation and the relief of dental pain. Mostly because ibuprofen as an anti-inflammatory does a good job in relieving the inflammation, which causes most of the pain. But also Tylenol in its own right is a very good analgesic agent. So when you combine them, you get that synergistic effect. The issue has always been patients don't think they can take ibuprofen and Tylenol together. Most people will say, I'll die. I can't do that. Aren't they the same thing? And so part of it's education, no question about it. But also it's us in dentistry looking at it from the perspective of we're going to tell patients exactly what to do. We're going to tell them to take 600 milligrams of ibuprofen because that seems to be the sweet spot. We're going to tell them to take, in addition to that, not alternating, as I know a lot of us think, 500 milligrams of acetaminophen, Tylenol together, and maybe add a little caffeine. Caffeine as an adjuvant really does a great job in boosting the analgesic effect of those two. And that cocktail, we really are following the science that suggests, it's 600 milligrams, 500 milligrams, and caffeine. So we're following the science, but we run into a bit of a brick wall when it comes to, well, what about the opioid? We have to have an opioid. I mean, we have to have something to treat moderate to severe pain. And so I've always told my audiences, you certainly can use an opioid, but the opioid really becomes placebo. It becomes, well, I'm going to give you this script, but only use it if it's really bad. And most patients now who know that opioids can lead to problems typically take that script, put it on file at the pharmacy, and say, well, if I really need it, it's there. And well, that's the placebo because I am now in control, right? If it's bad, I'll take that medication. But if I don't need it, I'm going to be okay just with ibuprofen and Tylenol.
Mm-hmm. Fascinating. And certainly that's been my experience when I've had dental procedures as well. I mean, you're just exactly what was prescribed. Now, what else would be important for, let's say, for the meeting planner that might be considering bringing you in for this course? What else would be important for them to know about this course? Anything else as far as topic that's covered?
Yeah, the course is designed to encompass all of the things that I've seen as far as requirements in multiple states so far that have some type of opioid requirement for continuing education. So it goes into not just obviously ameliorating pain with non-steroidal anti-inflammatories and Tylenol. We also talk about appropriate prescribing. What are the quantities? What are the doses? Is it different for younger folks versus older folks? Is it different for patients based on their weight? We also talk about how to prescribe an opioid. How many do you really need? How many dosage units? So I typically say no more than 10. If you need more than 10 dosage units of Vicodin, which represents at that point 3 times a day dosing, more than 3 days, we've done something wrong, or the patient needs to be reappointed because, again, our goal is 48 to 72 hours. But I also get into things like identifying opioid dependence and also getting into using prescription drug monitoring programs, which are, I think, have changed the landscape completely. Mm-hmm. They're just so effective in rooting out opioid dependence and abuse. And then we talk about treating opioid dependence. What's Narcan? How do you use it? What's Vivitrol? And what's the new drug Sublocade, which seems to be giving Vivitrol a run for its money. And then we finally get into how to dispose of opioids properly. So if a patient has opioids at home and they want to get rid of them, but they don't want to wait till the drop-off date comes for their township, how do you dispose of these things? Do you flush them? No, you mix them with coffee grounds or cat litter and crush them up and toss them out in the trash. So it's a lot of fun because I try to add a lot of humor to it as well. But at the end of the day, it sort of streamlines and removes a lot of the misinformation and focuses on just what you need to know as a dental professional.
It certainly sounds like a very comprehensive course. I noticed there's one thing you mentioned in there about the prescription drug monitoring programs, and you mentioned that that's something that's really been helping. Can you tell us more about that? And is that something that's available to everyone?
Every state has a different take on it. Some states require a prescription drug monitoring program to be looked at or to be consulted before the dentist prescribes. Some states make it voluntary. Some states do a hybrid and say, well, it's not required to check the drug monitoring program if you prescribe 3 to 5 days, but over 5 days, yes, it is. All a prescription drug monitoring program is, at the end of the day, is a database of prescriptions that were filled in the recent past by patients for opioids and other controlled substances. And so whether you're obliged or not to check that database, I often encourage my audiences to do exactly that, because it's information that's available. And at the end of the day, what else is on there? Drugs like Suboxone and Vivitrol and Sublocade. And I've often said, you don't want to be that practitioner, the one that prescribed that opioid to a patient who's in recovery, who's on those medications, because you just set them back in their sobriety and in their quest for, overall getting out of or independence from opioids.
Wow, that's really important, and so important for all dental offices to know about. It was something that I learned about fairly recently through you. So I'm not sure how well known that is out there, but what a wonderful and helpful tool for the different dental practices. So we've talked about this from the standpoint of the meeting, and I know you have another opportunity for online CE, but before we go there and walk away from the, like the meeting planner that might want to hire you for this topic, tell me a little bit more about the format of this course. Is it typically, 1 hour, 3 hour? Do you do more of a lecture or a workshop? Who are your target audience members, that sort of thing? Help our event planner kind of picture how they could use this in their meeting.
Yeah, the live course is a full 3 hours. And I say full, meaning it could probably go to 4 because there's just so much to talk about. But I try to limit it to 3 hours only because I know what works for most meetings is, a 3-hour course in the morning, an hour break for lunch, and a 3-hour course in the afternoon. This course marries very well with 2 other courses I offer. I've Become Comfortably Numb, that's my local anesthesia course, and Top of the Heap, which is my course on the top 25 most frequently prescribed drugs. So in a day of a 6-hour day, you really get the full landscape of pharmacology. I often call my courses, what I forgot about pharmacology, but I wish I remembered. Those are the key points that I would like my audiences to leave with. So I focus on the practical, I focus on the applicable information, and not so much of the extraneous stuff that really doesn't matter to daily practice. Online is completely different. Online, in my opinion, I have a captive audience. So I do hour segments. And so you can get your 3 hours required CE or 2 hours required CE or whatever combination your state requires by attending an hour lecture at a time. Each one has its own test, so you get 1 credit for each one. And that sort of covers all of the different states' requirements between 1, 2, or 3 hours. But since they're their own entities, you don't miss anything if you've missed the last section. So you can take the first 2, you pretty much get the full idea of what it's like to prescribe opioids and treat pain. But I also get into, in the live course, a lot of Q&A. And I'll tell you what's interesting, Vanessa. I found this interesting. A lot of questions about cannabis. A lot of questions about using marijuana to treat opioid addiction, or even as an escape route from opioid addiction, or even to treat pain. So something like that, and other topics, you're using Sprix nasal spray, for example, which is ketorolac, which is really not destined for dentists, but is being marketed to dentists, and other things like tramadol, Ultram, that we hardly use in dentistry, but all of a sudden now are looked at as options because we're trying to move away from using opioids. And I talk about, while they may be options, let's stick with what we know. We know ibuprofen and Tylenol works, plus a little caffeine, but I'm always open to suggestions. And I'll be the first to tell you that there's a lot of research to be done with cannabis and other items. So, future looks bright. Let's see what we can do in those areas.
Well, it's such a fascinating field. There's so many options, and I love how you're painting the picture for us. And so what you were just sharing with us were some of the options of what's covered in your online CE course, which you were saying could be, it's 3 hour credit, 3 credit hours, 3 CE credits.
Right.
is broken up into 3 1-hour segments. And
Right.
so I'm going to show your website address here, which is a tough one to remember, tomviola.com.
Really
Love,
original, Tom. Good job.
love that. And so you can visit tomviola.com. I believe it's Online CE is the name of the tab there where you can look for the course we're talking about now is called Hurts So Good. But you do have multiple other courses available there for Online CE. And my understanding is you just click on register and it takes you right to where they can watch. You can pay for it. It's a low price. You watch the video, take the test, and then it prints out your CE certificates, which is pretty awesome. So that's great. Now, is there anything more important sorry, let me say that differently. Is there anything important that we haven't talked about as far as the online CE course? Is there something that, for instance, why would I as a dentist or dental professional need to take that course? What would attract me there?
The greatest thing about the online CE is convenience. You can take it anywhere on any device. So it's formatted to work on a phone, an iPad, a computer. And, I've learned one thing about dental professionals, especially as I get older and it seems like everybody gets younger. And that is that, we rely a lot on electronic media now. So sitting in front of a computer may not be for everyone. Maybe I want to do it while I'm doing my laundry at the laundromat, or maybe I'm on the golf course waiting for my turn, or maybe I'm just sitting in traffic, and I decided to pull over at a rest area and do some CE. The point is you can start and stop the video anytime you want. And when you finally finish and get to the last second, then you forward immediately to the test. So you can pick it up and put it down as often as you like, but it's CE on your terms. It's continuing education in a different format. You can view it at your convenience in your PJs on a Sunday morning with a cup of coffee, or you can do it on the run.
I love that. And I think that really appeals to multiple generations, I think across the board. And I also understand that many state boards of state boards of dentistry have mandated this type of a course. Is that correct?
They sure have. A lot of states are requiring 1, 2, or 3 credits, depending on the state. Some of them require it annually, some biannually, some just once forever. So there's no real consistency about the requirements. But the beauty of the online course is it satisfies them all. I do think that while the online course is great in its own right, a lot of practitioners seem to like the live course. They seem to want to get in there and listen to what everybody else is saying and what their colleagues are doing in their practices, because I noticed again in dentistry, we seem to be sheltered a little bit in our own practices. We kind of operate in this one little office day after day, and we don't really get to see what's going on outside our office. So this is their opportunity to come in, talk to their colleagues, get some discussion going, and walk back to their office and say, I can adopt that change, or I'm doing pretty good on my own, and sort of get that affirmation that they're looking for as far as being on the edge of the newest science and treatment planning.
Mm-hmm. Absolutely. So as we look at our overall, what we've talked about our online courses, we've talked about our in-person courses. Is there anything important that dental professionals who are listening into our broadcast to know tonight should know? Any kind of maybe a one-line, bottom line around this topic that it would be important to share? Is there something that comes? I'm throwing a curveball.
No, it's all good. I can tell you the one thing that pops in my head immediately when you said that. Change is good. And things change so quickly in dentistry. And that's so unlike me to say, because I've been known to say, gosh, I wish, we weren't so stuck in our ways sometimes, that we should think a little more open-minded. And yet with this particular thing, with opioids, with especially in the treatment planning and the treatment of opioid addiction, I'm saying things this year that I didn't say last year because the landscape has changed. So I encourage practitioners to come in and listen, take the online course, sit down at the live course with your colleagues and see what's up, see what's new. Things have changed dramatically, even over the last 12 months.
Thank you for that. I agree with you. And especially in this area, it's important that there be change. And also, let me just add a little unsolicited testimonial here that I have sat in on a couple of Tom's courses in the last year or so, especially most recently here at the Arizona Dental Association's meeting. And
Great.
as we were listening, as attendees were leaving that packed ballroom, where I would say that for several hours you had them almost rolling in the aisles because of you would think this might be a dry or boring topic, right? For those who aren't really into like the science or that sort of thing. But it was anything but. It was very well put together in a way that would appeal to the broad audience with just the right amount of humor, with just the right amount of that deep knowledge of learning. So congratulations and kudos on that. And I see why you are receiving awards as a award-winning teacher, and you're highly recommended and sought after speaker in dentistry. And it's been an honor to have you here tonight, Tom.
It's been a pleasure as always working with you, Vanessa. Thank you so much for the opportunity, and just want to say hello to everybody out there, and hopefully I'll see you soon.
Oh, absolutely. Now, before we go, I'm just going to run up here again to find out more about Tom's courses. Visit for Dr. Tom Viola, visit tomviola.com, or you can email Tom at Tom Viola to reach out to Tom specifically if you'd like more information about hiring him to speak on the circuit. Or you can also visit dentalspeakersbureau.com, where you'll find Tom listed. His contact information is there. He has a wide range of courses available that are all listed on that site as well. And if you'd like to email info@dentalspeakersbureau.com, we'd be happy to put you in contact with each other. So thanks again for being here, Tom and Erwin. And we almost made it through without the cats. And have a great night. And until next time, be well.
Thanks. Bye now.